friends. Welcome to our wonderful series called Obesity Care with Dr. Kanica Yashi. And as you know, obesity is becoming a serious threat to us in the growing years. Obesity is now a burning issue and a major health crisis. And if not addressed soon, we will witness many succumb to this deadly disease. We have witnessed and we have seen in our previous episodes with our subject matter expert, Dr. Yashi, talking about different topics on obesity in children and youth and college students, how obesity affects mental and physical health, and what obesity is and its implications, and many other topics. And on that note, we are digging into today's topic, which is a very important topic. It's called medical management of obesity. So let's talk to our lead guest and subject matter expert on obesity, Dr. Kanica Yashi. And yes, we have a special guest as well, and she is Dr. Arjjot Narula. Dr. Kanica Yashi is trained in internal medicine and obesity medicine and is American board certified in both specialties. She currently practices at Cooperstown, New York, and is a hospitalist and as well practices obesity medicine. She's a skilled educator and researcher involved with multiple studies as well as holds important leadership positions with the Obesity Medicine Association and the New York chapter of the American College of Physicians. And yes, our special guest, Dr. Arjjot Narula, is an internist at a big hospital system in Western Pennsylvania. She's pretty busy at outpatient practice treating multiple common medical issues, including hypertension, diabetes, high cholesterol, sleep-related issues as well. She also treats a lot of patients with weight loss. Okay, so let's welcome our lead guest and subject matter expert, Dr. Kanica Yashi, and our special guest, Dr. Arjjot Narula. How are you doing both? Tell me.
I am good, and thanks for having me here.
Hi, Sharat. So excited to be here, just like always. Thank you.
Thank you so much, Dr. Yashi and Dr. Narula, coming to our episode. And we are at episode 7, and we have covered a lot of topics, and we have got a lot of suggestions from our panelists and our subject matter expert, Dr. Yashi. And Dr. Yashi, I want to ask on that note, we have covered a lot about physical activity and eating better to help lose weight. But there are all these options like medications and weight loss surgeries to help lose weight. So who exactly is eligible for medical management?
Right, Sharat. So just like you identified, in addition to the lifestyle, there is this whole array of medical management, which comprises of drugs as well as weight loss surgeries, which can help an individual lose weight, which I do feel is a lot underutilized. However, who it can be used for is not a simple answer. There are a lot of factors that go into deciding who could be eligible for this. But by far, a common factor or an entity that we use to decide which person we can put on a weight loss drug or refer for surgery is the body mass index, that is the BMI. So typically, if a person has a BMI of 30 or more, they become eligible for weight loss drugs. Or if they have a BMI of 27 or more and have a chronic disease like diabetes or uncontrolled hypertension or metabolic syndrome or one of those, so they are also candidates for weight loss drugs. In terms of surgery, people who have a BMI of 40 or more are eligible for weight loss surgeries. However, they could also be eligible if they have a chronic condition, just like I said, like uncontrolled hypertension, diabetes, or many other that are on the list, and have a BMI of 35 or more. So these individuals can also become candidates for the weight loss surgery.
Dr. Narula, tell us about the medications you have used in treatment of obesity in your clinic and in your practice.
So first off, let me start by saying that obesity management or weight loss has been done for decades and decades and decades all over the globe. So these are not new medications. That's the first hesitation that a lot of patients have, whether these medications are too new or do we know enough about them. So the answer is yes. We have been using them for a while. Some of them are new, some of them are decades old, right? So the first one that my go-to is phentermine, which has been used all over the globe for many decades now, a very well-tolerated medication, goes by the name of Adipex in US, very well available in India as well. So phentermine has been used, the average weight loss that we get is about 3% in the first 3 to 4 months. It could be as high as 6 to 7% if we use it properly in the first year or so. So phentermine is a very good drug. Again, as I said, it's my go-to for the first-line management. But then we have to keep the things in context, right? If a patient has, say, a diagnosis of migraines, they've been struggling with that, then I'm not going to use phentermine. I'm going to use something called topiramate or Topamax, which could work for migraines and also help her lose weight. So that's a win-win. So I think that's the way to look at it. What is going on with the patient besides just wanting to lose weight, right? On the same token, if somebody has been struggling with diabetes and I need diabetes management plus weight loss, my go-to would be something called semaglutide. The market name is Ozempic, and I think it's widely available and is being used in India also. So Ozempic will give you an average of 15% weight loss, believe it or not, which is huge. When we talk about weight loss for cardiovascular benefits, we say 10% weight loss could get you off of, or if not off, the blood pressure medications. Maybe we can minimize the use. It's a big plus. And weight loss is not only for cardiovascular issues. It's going to help you walk better. Low back pain is better. Arthritis in the knees is much better. So a lot goes into weight loss. The other one which I use a lot is Wellbutrin. So a lot of times, patients are very conscious of the weight and cause a little bit of depression or makes them a little anxious, right? So Wellbutrin, going by the books, used to be an only antidepressant, but then we noticed it has a lot of weight loss benefit to it. So you keep the patient happy, they're physically perked up, they do more, they eat better, and they lose weight. So everything is in context. What does the patient need in addition to just weight loss, right? So that's how we look at it. The newer stuff, the liraglutide, which is a daily injection, very minimal side effects. We have to screen the patients appropriately. They should be able to give the injections to themselves. It's not the typical injection with the long syringe. It's a very small syringe. It's a very easy injection. And we have the pharmacists train our patients in the office before we give them the supply to use at home. Results have been phenomenal. I've been using liraglutide for over a year now in my practice. Hardly any side effects. Of course, it's a new chemical. Some GI side effects, like maybe a little heartburn with the first few doses, but patients tell me it's not at all a hassle for them. So that speaks volume for, these injectables. And the second would be semaglutide, as I said. The third one, and it's almost a miracle. I call it the miracle drug. I'm not sure if it is available in India not yet, but it will be soon. And it's on the fast track for obesity management approval, but it's already being used for diabetes. So the chemical name is tirzepatide, and the easy name is Mounjaro. So up to 22.5% weight loss, which is unbelievable. For somebody to lose this much of weight in 6 to 8 months, feel much better, diabetes numbers are much, much better. So that's why I call it the miracle drug. But not very commonly used yet for weight loss, but it's on the way, should be here any minute. So these are the few favorite drugs that I have that I use for weight loss.
Thank you. Thank you so much, listing down all the medications and, going back and forth with the pros and cons. A bit more about their efficacy, about the medications. And to add to that, how do you deal with any repercussions or side effects of these drugs?
So we'll again list all of them. So we'll start with the phentermine because that's the most widely used drug here. The most common side effect that I've heard from the patients is tachycardia. If we ask them in detail, couple of seconds of palpitations and then I feel okay. And that's to be expected with the first few doses. In terms of other side effects, hardly any that I've come across. Of course, literature dictates, it writes everything that the patients should be aware of. But usually I've never had to stop phentermine for anybody. I usually give everybody a break after 6 months of using the drug just to see how they do without the medicine. So when we talk about medicine, it's a lifestyle change. You're not going to do only medicine and not exercise. You're not going to do medicine and eat a lot of rice, right? So everything goes hand in hand. That's how we need to look at it. So usually 6 months later, we give them a break for say 2 or 3 months, see how they do with lifestyle. Most of my patients have been able to maintain the weight at least. They don't gain weight within 2 to 3 months of going off of the medication. And what does that do? Gives them the confidence that they know what to watch for, they know how to exercise, and they know when to say no to food. With all the festivities around the corner now, Thanksgiving is coming, Christmas is coming, it's very hard to say no to the pumpkin pie on the table, right? So keeping all those things in perspective, when you have that confidence that, I can say no, it's a big skill to have. So now going on to the next one, Wellbutrin. Just today morning, I saw a patient and she said it causes a little bit of insomnia for her. So what did we do? We changed the timing of it. I said, don't take it with lunch. Please try to take it with breakfast. Problem solved. So there's simple things. There's simple things that you can tweak to make it work better. And it has to be based on what the patient is, as in what kind of work they do, where are they in the world, if they're traveling and their sleep schedule is off, they can take the medicine according to their convenience. They don't have to stick with the chart that I gave them. So there's a lot of back and forth that has to go in to keep them taking it. Saying, oh, I can't take it is very easy, but working with them, titrating the dose. Okay, you can't take the full dose, let's take the half dose. Standard dose of phentermine is 37.5. I usually start with half the dose, and believe it or not, I see wonderful results even with half the dose in the first 3 to 6 months. So that's a learning that we have to learn as providers, how to work with the patients. Not everybody is the same. The last one, the injectables, which I just talked about, the newer ones. Pancreatitis is a very big risk that's listed on the website. I'm yet to see anything, which is good. So just reassuring the patient, if you have any symptoms and they're becoming more and more, just reach out to us. And, we can either titrate the dose down to where we started off from, or, we can just switch to another agent. Mm-hmm. So we just have to work with the patient. You have to be in touch. It's not like I see you today and then I'll see you in 6 months. This weight management doesn't work very well with that. There has to be frequent follow-up. There has to be touch points either with the provider or with the nutritionist. I do have a very good nutritionist in the office who helps me out. So if they are not seeing me, they're touching base with her, and then she briefs me about what's been going on. So that's how I do it here.
Wonderful. Thank you so much, for giving all the technical details, patiently listing down everything as I said, and talking about the side effects and how to intelligently mold or change your lifestyle and have a balance of the medications.
We just have to work around what the patient has going.
Right. That tip was brilliant, Dr. Narula. So I'll move on to the next question. Dr. Yashi, tell us, we discussed in the first question, you asked about, weight loss using surgeries. Tell us a little bit more about these surgeries to lose weight.
Yeah, so there are a lot of different kinds of surgeries that are available these days, but we really have to see the patient profile as to which surgery is amenable to one person as opposed to the other. So the idea of this surgery is really to decrease the size of the stomach or to bypass the stomach to decrease the absorption of the food. So in the surgeries, the popular ones are sleeve gastrectomy, where they basically decrease the size of the stomach. That is, they remove about 70 to 80% of the stomach. And once that's gone, it automatically decreases the size of your stomach. So your absorption is decreased and you start losing weight. The second common one is gastric bypass surgery, where what they do is cut across the stomach and they create like a little pouch. And then that pouch is then connected to the small intestines. Again, basically bypassing the stomach and decreasing the absorption of the food. The third one that they use is gastric banding, where what they do is they put in a silicone gastric band in the upper part of your stomach. And that sort of decreases the volume of the stomach and how much food you can really put in the stomach. It makes you full earlier, and thereby decreasing the your how much food you can take, as well as altering your appetite. So, and besides these surgeries, there are a lot of other procedures that people are offering, the surgeons are offering. However, these three still stay the most common approaches in the terms of surgeries.
Dr. Yashi, thank you so much for educating our audience and myself as well about the surgeries and how you execute them and the procedures as well, and their nomenclature too, for us to understand. Tell us, because there's a lot of conjecture about, especially surgery to lose weight. People talk about different things. There are risk factors involved and repercussions. Can you talk about that?
Yeah, so the surgeries are not just for any and everybody. We really have to screen the individuals for various things to even, take them as a patient for surgery. Because after the surgery, they have to follow a certain diet, drink a certain amount of water, take certain kinds of nutrients. So that kind of knowledge needs to be there. I also explained the surgeries in a very simple words, but obviously it's a complicated procedure. So we really have to screen individuals as to who can get the surgery, given their comorbid conditions and their maintenance level after the surgery. However, in the literature, the surgeries are very safe and they are very effective. However, they are a life-changing procedure in a way. So it does come down to adapting to things after surgery for most people. And I see why the hesitation people would have to just venture into surgery. And that's understandable. However, like I said, the surgeries are effective. And if you have seen your bariatric surgeon and they deem that you are fit for it, and you are ready to follow the pre and post-surgical things that you need to, the outcomes are great. And for most people, 2 or 3 years down the line after surgery, the results are also terrific. The surgery also becomes important in the sense that sometimes the BMI of a person may be so much, like over 35 or 40, that even when they are following the right kind of diet, exercise, and the medications, that may not work 100% or completely to help them get to the right weight. And that's where the surgical approaches come. Like I first mentioned, that surgery is not for every and anybody. I mean, you really need to be in the BMI of at over 35 or more so over 40 to even be considered for surgery. So, yeah.
Thank you. Thank you so much for that wonderful information. And I'm very sure it will be useful for our MANATVINT international audience. As usual, I mean, you come up with brilliant answers. Dr. Narula, tell us, being an obesity specialist, your inference, what are people usually using? I mean, are they using more medications or more surgical approaches to help them lose weight? What has been your experience in your tenure, in your medical tenure?
So, as Dr. Yashi had just mentioned, that surgery is not for everybody. We have to be very careful about who we are picking for the surgery, because it's not about just healing from the surgery, it's being able to maintain that lifestyle. Right. So what I've seen is usually everybody wants to try the medications first, see what the success is, and given a time frame like 6 months, let's try the medications for a year, let's see how you do. And if the BMI is just too much and we know that medications are not going to bring it down enough to where they will benefit in terms of comorbidities, then we funnel them through for the bariatric surgery. But usually everybody has to start with lifestyle management. Nobody's ever come to me with a BMI of, say, 35 and say they have diabetes, and I've said, okay, you're not a candidate for medications, you go right to the surgeon. It's not good for the patient, and it's not good medicine in general. We have to give them a trial of medications. We have to start them working, get started on the lifestyle with a nutritionist, hitting the gym. There's a lot that goes into it. Now, say they tried it for 8 months, didn't work, we'll try a different medication, we'll increase the doses. Let's give it another 6 months, didn't work. Then yes, I'm not going to keep them there forever without any significant motivation or gains in terms of, health. So that's when they go to the surgeon. So as Dr. Yashi had mentioned, that BMI of 40 for a bariatric surgeon, or 35 plus a lot of comorbidities which have not been helped so far by lifestyle management with medications. So most of my people benefit a lot, as when they see the BMI decreasing from 35 to 33 to 32, it just keeps them going. Sometimes it just takes the motivation, nothing much, just the motivation that I'm on the right track. I have the tools to work with it. These medications are not hurting me. And they themselves shy away from the surgery then. Because after the surgery also, it's not like we can eat whatever we want. No, it is a strict lifestyle. And that's the part that we need to focus on for patients to understand that surgery is not a one-time fix. It's not a fracture that it's healed and it's done. We are never back to baseline after that kind of surgery in terms of eating or in terms of what we can do with food. So that's an important message that I always have for the patients. If you're considering surgery, don't think it's an easy fix. It's a lifestyle that you'll have to get used to for the rest of your life.
Thank you so much. That was really useful information. And we're almost at the end of the show. Before that, I'm going to ask a question. Dr. Yashi, again, as I spoke about conjecture, this may or may not be, but my question to you as a layman, and a lot of people have this question in their mind. We keep hearing and reading about, people having thyroid, chronic issues like thyroid and diabetes, and they're not losing weight. And is it necessary, for them to lose weight? With these chronic issues in play, what do you think is the right approach, or what do you think is the right kind of advice you want to give our audience for having, these kind of, doubts in mind?
Right. So, issues like hypothyroidism, that is a low thyroid hormone, or type 2 diabetes uncontrolled, it does make it difficult to lose weight if they are not treated. So what happens is that if you have a low thyroid hormone in your body, it decreases your basal metabolic rate. If you have an uncontrolled type 2 diabetes, it increases your insulin resistance. So these things do make it difficult to lose weight if they are not treated. So I would say that please have these things fixed if you are trying to lose weight, or if you are venturing into that direction. Have yourself screened for that. Another issue, although not very common, is high cortisol levels. It is a hormone that is sometimes, almost always secreted by adrenal gland, which is a gland that is placed on top of the kidneys. So if you have high cortisol levels, that can also make it difficult to lose weight. We don't always screen for cortisol levels in patients, if they are unable to lose weight, if we know that they have thyroid issues or other issues to first treat for. However, if it's been a while and they are not able to lose weight, we do go ahead and check for a cortisol level to see if it's the hypercortisolism that's making it difficult for them to lose weight. So those are about the hormones. At times, lack of sleep or just experiencing a lot of stress can also increase the cortisol levels as well and make it difficult to lose weight. So there is some truth to the question that you asked.
Thank you so much. And we are at the end of our session here, and it was really meaningful, and as I said, very much educational for all of us, especially our audience who are witnessing these lovely series of 8. And we are at episode 7, and we are at the end of the show. But before leaving, I want both of you to give any lovely suggestions to our audience, so that they can imbibe and apply in their daily life.
I just want to reiterate that that obesity is a very complex disease. Lifestyle, including the right kind of diet and physical activity, is key to losing or maintaining weight. However, once you are of a certain BMI, please know that there are medical management that exists to help you. For example, the medications that Arsh mentioned, which have been there for decades, however, still underutilized by a lot of practice and providers. These medications are safe, however, they are not for any and everybody. So the healthcare provider needs to be very cautious as to who they are using this for, as well as how to manage. However, for our viewers, I think please go to your healthcare providers and see if you may be a candidate for this medication or not, and just talk to an obesity expert if that can that can work for you as well.
Thank you so much, Dr. Narula.
Yeah, just going on the same direction as Dr. Yashi had said, it's a very sensitive topic, right? So the provider, if they don't know you enough or don't know you that well, they might not bring it up themselves, not knowing that you really want to talk about it. So bring it up yourself. If it's something on your mind, bring it up. Talk to the provider. And if you say, I'm at a point where I've tried lifestyle management, I've tried to minimize the stress the best I can, and I'm not making a headway, they will be more than willing and happy to talk to you about it and talk about the medications. But it's a sensitive topic. There's a social taboo around it. So bring it up yourself. Do not hesitate. There's a lot of medication out there, and these are good medications. Rather than struggling physically and mentally, be open to a discussion. Asking for help is half the battle. I always tell all my patients, asking for help is half the battle won already. It'll be just easier here on. So that's an important thing to remember.
That's a great point. That's a great point, Arsh.
Thank you. Thank you so much, Dr. Yashi and Dr. Narula. Next week is our final episode of our 8th episode of our series of 8 called Obesity Care with Dr. Kanica Yashi. So stay tuned for the next episode for more wonderful information about obesity and obesity care. And please don't forget to subscribe our YouTube and Facebook page, that is MANATVINT, and keep watching our series of 8 called Obesity Care with Dr. Kanica Yashi. And this is your host, Sharat. Thank you so much.
Thank you.